Heather Dawson. The cheese store of Beverly Hills, one of the first real cheese stores in the country, an iconic LA foodie destination, is officially changing ownership after 4 decades. Let's hear this cheesy story firsthand.
My name is Norbert Wapnick, and I've owned the cheese store of Beverly Hills since 1978. I came to California to become a rock star, and that went so well that I had to get a job here for $1.80 an hour. One thing led to another, and my family helped me buy the store. It was one of the first real cheese stores in the United States, and it has sort of grown with Beverly Hills. And the people that live here are well-traveled, affluent, and have expectations. If they want good cheese, they come here.
I'm Dominic DiBartolomeo, and I've been part of the cheese store for the past 20 years. You know, when growing up in New York City, I knew I wanted to be involved in food. This was the store that can help me learn. I never once felt like I worked for Norb. I always felt like I worked with Norb. Norbert allowed me to actually start my own business, Domenico's Foods, and make mistakes, learn my business, all while working here at the store.
Because the store has a very unique feel to it, not everybody would get it. Dominic got it. The minute he walked in, I realized that he is right for the store. So after 44 years, it's time to pass the torch, and no one better to receive that torch than Dominic.
It's not only a place where I launched Domenico's Foods, it's a place where I harnessed my craft. I actually met my wife here.
Walked into the cheese store and immediately spotted Dominic. We had a really nice conversation. As I was leaving, he gave me a loaf of bread to take, and that's when I thought there could be a future in this relationship. And a few years later, he proposed to me in the very spot where we met.
It's my honor to continue the legacy and to provide the community with the level of quality and service that's synonymous with the Beverly Hills experience. And we've got big things in store.
Why do we eat our feelings? Nutritionalist counselor Dr. Iflin discusses the difference between emotional eating and physical hunger. Here's Elise.
Hi, I'm Elise Thurston. Today, I will be interviewing nutritional counselor Dr. Joan Iflin, who specializes in emotional eating, food triggers, and the psychology behind binge eating. How are you, Dr. Iflin?
I am just delighted to be here. Thanks for having me.
Thank you. And I'm so excited to talk about this subject because I think that this is something a lot of people struggle with, especially after quarantine. For me, a lot of the people I know, many of us, we turn to food when we're under stress, when we're in fear, when maybe we're just bored, because it can give us this false sense of fullness. Mm-hmm. And I'm curious, what emotions would you say trigger food cravings the most? What emotions cause, which ones should we look out for?
Yes, and this is such a good question. Any strong emotion can trigger a reaction in the brain, which consists of hyperactivating the reward centers in the brain. And that means your brain just floods with cravings. When we're under stress, the brain will try to make us feel better by activating the reward centers, the pleasure centers, but that activates the addiction too. So this is not, it's just a mechanical action in the brain that is the result of a lot of addictive business practices related to processed foods.
And that's interesting that you say processed foods, because I find myself, and I think a lot of people, when we are craving foods, we go to these childhood comfort foods, these carbs. What would you say, what is it about these snacks? Why do we like snacks when we're emotionally eating?
This is a good point. So the snacks are addictive. They have been formulated to be addictive. They've been formulated to hyperactivate those reward centers so that we lose control and we are under the influence of those cravings. So we know things like sugar is more addictive than cocaine, and fats activate the same part of the brain as marijuana, and excessive salt and dairy have withdrawal syndromes that are just like drug withdrawal. So that we go to the processed foods the same way 50 years ago we went to cigarettes. When we were upset, we smoked a cigarette. Now the tobacco companies, with their addiction business model, they moved into processed foods in the mid 1980s. And you just like have to say, what is the motivation of an addiction company to come into processed foods? Well, they saw an opportunity to create addiction.
Mm-hmm. I think that's something that a lot of people, that we crave those cookies, we crave something to snack on. And so another thing that I think is really interesting about hunger is a lot of times we don't always recognize when we're physically hungry.
Mm-hmm.
We want to eat something, but maybe our bodies don't actually need food at that moment.
Mm-hmm.
So what are the signs to tell the difference between I'm just emotionally hungry right now or I actually need food right now?
This is such a good question. Cravings happen in the head, and they are for these foods that we've been duped into thinking are foods, but they're actually drugs. If you're hungry, it happens in your stomach. Your stomach is right underneath the bottom of your ribs, and that's where you'll feel it. I would say that step one for distinguishing between cravings and hunger is to get the processed foods and the signaling, the messaging, the advertising, this food stimulation, get that out of your home, get that out of your workplace. Stop eating processed foods in the car. So get the cravings to stop, and then you will know that if you want to eat, it's hunger.
Okay, that's so basically, if we recognize, okay, I am an emotional eater, I do that. The biggest thing you recommend doing is to just cut out those processed foods. Start eating healthier, lean meats, chicken, vegetables.
People don't realize that cravings are not normal, because I know for myself, I went to kindergarten with cravings. I ate sugary breakfast cereal and dairy. I had milk and toast and jelly and margarine on it. And those were all addictive substances. So I didn't know that it's possible for cravings to go away. But that is one of the greatest gifts of getting through withdrawal from the processed foods, is the cravings will stop, the obsession will stop. You get your brain back, and it's wonderful. But you do have to kind of create a bubble of protection around yourself, because the food industry is quite intense. You're constantly trying to signal, constantly trying to activate that addiction and get you to lose control and eat things that you regret.
I'm very thankful that I got to speak with you today. I think it's something a lot of people can take to heart.
Well, obesity has become a very significant health issue here in the United States, especially as it relates to communities of color, and more specifically within the Black and Hispanic communities of California. Here to talk about this issue is Rhonda Smith, Executive Director for the California Black Health Network. Rhonda, thank you for joining us today.
I appreciate the opportunity to be here.
You know, Rhonda, when you look at the numbers in terms of those who are tagged as being obese, especially in the Black community here in California, the numbers are quite staggering.
Yes, they are. In California overall, we know that 1 in 4 Californians are dealing with or struggling with obesity. So that equates to about 11 million people here in the state. In our community specifically, we know that number is about 4 in 10, or 40% of Black Californians are dealing with obesity. And so, yeah, the numbers are significant. And so when we talk about lack of access to innovative and necessary therapies to treat obesity, which is a disease, we're talking about a significant number of people that could end up with poor health outcomes and also leading to other health conditions as well.
What have been some of the contributing factors that have made this issue such a big problem in the community there?
Well, obesity is a disease, so it's more biological. It's not always a choice or a lifestyle issue. And so it should be treated like any other chronic condition with the proper therapy or access to the necessary drugs to treat an individual's health condition. So outside of that, we know that there are conditions in the environment in which people live that they have no control over. And so sometimes people are unfortunately living in food deserts or medical deserts. So the lack of access to fresh, healthy foods or even basic healthcare needs doesn't exist. And so those are factors that are known as social determinants of health that contribute to poorer health outcomes for our communities.
So really, it's kind of the lack of access, as you were saying, the lack of access to healthy food opportunities, the lack of access to exercise opportunities. Those are some of the issues that are really confronting the community there.
Yes.
With your organization, what are you doing in terms of trying to combat and try to offset what has been a growing problem there?
Yeah, so we are engaged in advocacy to make sure that there's legislation that improves access, that improves availability and affordability of necessary drugs and healthcare treatment for our community. We also provide health education. We do a lot of work to help improve the health literacy of our community. And I really like to say more health empowerment, because I think, especially now, considering the impact of HR1, our community and every individual who's a healthcare consumer really needs to be more empowered around their health and healthcare, and really focus on doing what they can within their control to prevent certain diseases from happening, that those that are preventable, and many chronic diseases are. Although obesity is a disease just like, heart disease or hypertension, or even diabetes. And so we have amazing therapies and treatments for those types of health conditions, and we should do the same for obesity.
So it sounds like you're providing people with a lot of different types of tools, if you will, that will help them essentially confront this health issue.
Exactly. We help people understand how to navigate the healthcare system, what their patient rights are, how to exercise those patient rights, make sure those rights are respected. And also, I think communicating with your provider and healthcare team is very important, and building that relationship also is very critically important to making sure that we not only get the access that we need, but also the quality of care and equitable care that is so needed for our community.
How can people find out more about your organization and getting involved and getting a hold of some of those vital tools?
Yes, they can visit our website, which is www.yourcbhn.org. That's yourcbhn.org. They can also follow us on social media. We're on Instagram, LinkedIn, and also Facebook.
Great. Rhonda Smith, thank you so much for joining us today.
Thank you very much.
I'm Alicia Stanford in Hollywood. Let's go to the movies. Disney is celebrating the end of the school year with a new musical adventure set during summer break in Hollywood's Stargirl.
I guess I didn't think we'd be moving again so quickly.
I thought you liked going on adventures.
Going on adventures is one thing, but having your whole life be an adventure is another.
But life is an adventure.
Stargirl Caraway wants to put down roots, but getting her free-spirited mom to stay planted is often difficult.
What if I promise that you will finish your senior year here? I mean, look at this. California is pretty cool.
It's a deal, and Los Angeles is the city where lots of deals are done. The young singer takes a chance at an open mic night.
I usually sing with a ukulele, but here's to trying new things. I was lying in my room and the news.
And luckily, her new neighbors are looking to make a deal of their own. They want to make a movie, and they want her to be in it.
All I wanted was to dream crazy things.
That is heartwarming and fun. Grace VanderWaal reprises her role as Stargirl from the 2020 film. Judy Greer is her free-spirited mother. Judd Hirsch is their neighbor. Tyrell Jackson Williams and Elijah Richardson are the hopeful filmmakers, and Uma Thurman appears as a washed-out singer idolized by Stargirl. This is a sweet family film with nice through lines about friendship and making your own kind of music.
Even if nobody else sings along.
That was a keeper. Let's take a break.
I'm Alicia Stanford, and that's what's going on at the movies.
They're creepy, they're crawly, and they are uninvited. It's those bugs and pests that start invading our homes during this time of spring. So what are we to do with them and how do we combat them? Here to give us some insight on that is Dr. Michael Bentley from the nonprofit National Pest Management Association. Doctor, thanks for joining us. We are at that time of the year where we're starting to see those bugs invade our houses. So why is it so important that we combat them?
Yeah, well, thank you so much for having me on. And you're absolutely right. They are more than a nuisance. You know, pests may seem like a small issue, but they can create major problems down the road. And they're more than just a nuisance because they can cause major structural damage and even make us sick. You know, termites steal billions of dollars in structural damage every single year, and most folks don't realize that those damage costs aren't covered by most homeowners insurance. Pests like ticks and mosquitoes, they can spread dangerous, if not deadly diseases, make us sick, and sometimes we don't even have to have an encounter with some of these pests for them to cause public health issues. A simple infestation is enough to be able to create some major problems from cockroaches and rodents. Their infestation inside of a home can affect our air quality, actually creating asthma-like conditions and respiratory issues. So this is the perfect time of year. It's spring. As we're getting into the spring cleaning mix, start thinking about some of those proactive pest prevention tips that we can do to protect the home.
You mentioned some of the species that we should be looking at. What are some of the other specifics that might pop up around the house?
Yeah, I mean, I will tell you, unfortunately, this is the time of year when we start to see everything come alive. That's everything from ants, cockroaches, rodents, ticks, mosquitoes, you name it, and termites. These are the pests that are some of our most concerning structural pests in and around the home. And this is the time of year when we see activity for all of those insects and other pests start to become a problem.
Now, you're in the hub of the house there in the kitchen, and quite frankly, it almost seems like they gravitate towards the kitchen.
Yeah, you're exactly right. It's almost like they gravitate. Well, I mean, it's, think about it. This is where we come for our midnight snack, and pests are no different. This is, food brings us all together, and food also brings pests together. So they're coming here looking for access to food resources. So one of the most important things that we can do is find ways to eliminate or restrict access to that food. One of the simplest ways to do that is to clean up food spills as soon as they happen. I mean, it doesn't take but a couple drops of a sugary drink or a few crumbs off of a cookie to provide an all-you-can-eat buffet for those ants, cockroaches, and rodents and all those other nasty pests that we don't want anywhere near our cooking space. The second most important thing we can do in terms of food is think about how we're storing food. Taking and making sure that we store leftovers as soon as we have them, or putting things in refrigerated spaces to eliminate access, but also thinking about how we store those resources. So I've got right here a nice sturdy resealable container. It's not only durable and pests aren't going to be able to chew through this most importantly, but it's also airtight, which is really important in helping to trap in those food odors, which can be a really important attraction to pests as well.
So how do we find out more information on this?
Yeah, for more information and tips that I've provided here, and for more information on how to find a pro, visit pestworld.org.
Dr. Bentley, thank you for joining us. We appreciate all the very helpful information.
Thanks so much for having me. Take care.
Spring is when many households hit reset by refreshing closets, bedding, and everyday laundry routines. Today, we're talking about fabric care principal scientist Jennifer Ahoney about a new laundry innovation from Tide that's helping families clean smarter, easier, and more efficiently this season. Tell us about new household innovations that are making cleaning easier and more efficient.
We've seen huge growth in the demand for laundry care solutions that are innovative, eco-friendly, and easy to use. We've launched Tide Evo to meet those needs, and Tide Evo is a brand new to the world dry laundry detergent format that cleans so well it's like real laundry magic. The tile is a revolutionary waterless tile that is made from thousands of tiny detergent fibers that instantly dissolve and activate in water conditions and delivers a powerful clean. It's a lightweight and compact form, which allows us to package it in ready-to-recycle cardboard box. And it's easy to use. It's a pre-measured format, which simplifies the laundry routine by reducing that mental load that can come from measuring and having to dose traditional detergents.
Well, that's it for us. If you missed any part of our show, go to our website. Please don't forget to like us on Facebook, follow us on Instagram and Twitter. I'm your host, Heather Dawson. We'll see you next time.